Normally, nursing students find it difficult to transfer learning into their clinical practice. That's why IvyTech Sellersburg is now using state-of-the-art patient mannequins as part of the immersive simulation lab. Unlike the CPR mannequins that we are all used to, the Simulation Lab mannequins can speak, cough, breathe, and wheeze. You can start IV lines on these high-tech computerized patients, check pulses, place catheters, listen for breath sounds and bowel sounds, even carry on a conversation with them. You can manually check the patient's blood pressure or review their vital signs on the monitor just as you would a real patient. You can provide care to help improve the patient's condition and make mistakes that will lead to the patient's demise. You can even bring a baby mannequin into the world. The Sim Lab also provides you with a clinical setting where you can take responsibility for all aspects of nursing care, including conferring with physicians and administering medication without the oversight of your instructor. It gives you a chance to develop clinical judgment and provides you with the complex clinical situations using lifelike examples. By integrating the Sim Lab into the LPN and RN IvyTech nursing curriculum, students are provided with interactive, challenging experience in developing and practicing team and decision-making skills. As a part of your IvyTech nursing instruction, you will be using Simulation Lab several times a semester. This high-tech environment consists of 2 simulated patient rooms, a monitoring system that records both audio and video, and a central control room where your instructor will set the parameters of your patient's condition and monitor your progress. Additionally, the Simulation Lab has an integrated monitoring and debriefing room that allows your fellow students to observe the scenarios in real time. After you complete your assigned scenario, everyone meets in the debriefing room, where you can review the video of the session to determine possible areas for improvements to your patient care. Prior to your scenario, the SimLab instructor will provide you with a real-life patient care scenario, but rather than explain the situation, they'll simply give you a standard shift report, just as if you were the new nurse taking care of the patient on the floor. Included in the report will be the patient's vital signs, condition, pertinent lab values, and diagnostic tests. The IvyTech Hospital includes hospital beds, med carts, crash carts, supply cabinets, and sinks, things you would find in any other hospital around the region. For the benefit of the simulation, the sink area and med carts are considered outside of the patient's room. That way, you can confer with a physician or support personnel on the phone in a private manner. For each scenario, you will have a lead nurse as well as a secondary nurse. And to make things more realistic, you'll probably have a few family members in the room to help you direct your care. This will help you practice your interaction with family as well as help you improve your skills in educating. The bed in the SimLab is a fully functional hospital bed. You can raise it, lower it, and incline or recline to any position. As a nurse, you will be pulling up your patients in bed and doing many procedures at the bedside. Something to remember is to not break your back. Raise your bed up. The wall behind the bed includes functional versions of the standard devices you find in patients' rooms, including oxygen, medical airflow meters, and suction devices. You control the suction with the toggle switch on the wall, and suction tubing is located in the bedside table. The monitor for your patient shows the patient's heart rate, EKG, oxygen saturation, and blood pressure. It is similar to the devices you'd find in other hospitals in the area and is operated via touchscreen. When you get a chance, take a few minutes and familiarize yourself with it. Being familiar with the monitor will greatly help you in your upcoming scenarios. You will also want to become familiar with the operation of the IV pump. While it may be different than some other devices you've seen in the area hospitals, the basic operation is still the same. As we mentioned before, your patient can breathe, talk to you, have lung sounds, and bowel sounds. Depending on what is going on with your patient, their heart tones, lung sounds, and their bowel sounds can change in a moment's notice. You can ask your patient questions and they will respond back to you. If you would like to check the patient's pulse, you can do so in the right radial area. The left radial and below the patient's abdomen is non-functional, and the nurse will have to ask for a verbal assessment finding. An example of a verbal assessment finding is when your nurse is assessing the feet. She will state, "I'm assessing the patient's feet for pulses and any edema." The SimLab instructor will give the nurse the information needed. Proper hand hygiene is important when you are in healthcare. The simulation lab is a hospital room and should be treated as such. Instead of washing your hands before you enter the room, you will use hand sanitizer as your soap and water. There are also gloves of all sizes available and should be worn when appropriate. In the top drawer of the sink cabinet combo are medication delivery items such as saline flushes, needles, and filter needles. In the second drawer, you'll find a selection of IV fluids with tubing already attached. Finally, you'll find various types of oxygen delivery devices such as nasal cannula and non-rebreathers in the third drawer. You can use the phone located on the cabinet to reach the various support departments, physicians, and/or the charge nurse. Just pick up the phone, dial the 3-digit extension 201, and a secretary will answer the phone and direct your call. If you're calling a doctor, don't forget to use SBAR and to have all the pertinent information about your patient. Should you be asked to administer medication, it's important that you know the correct route, dosage, and side effects. To help you out with this, drug books are located on the top of the cabinet for your reference. Do not hesitate to review this material before administering any medication. The medication drawers are located on the computer cart and contains medications that may be administered to the patient. This includes IV push and oral medications. Unfortunately, as the year progresses, the medication may get a little messed up, so take your time in locating the correct drug and dosage for your patient. You will use the computer to document your findings just as you would in an actual facility. The central supply area contains supplies that may be needed for the treatment of your patient, with physician's orders, of course. Finally, the code cart contains all medications and supplies that you'll need to resuscitate a patient in cardiac and/or respiratory arrest. Since you'll be using these in an emergency setting, it's important to familiarize yourself with the drugs and their location. Remember, your patient can die if you don't provide the correct treatment. The Sim Lab allows you to use critical thinking to solve problems and care for diverse clients in a safe, non-threatening environment where mistakes can be made without risks to patients. Simply put, the Simulation Lab gives you, the student, the opportunity to learn and develop skills that you will need for a future in nursing. It's important that you realize that the lab is a method of learning in itself. And just like everything in your education, the more effort you put into the simulation scenario, the more you will learn.
The antibiotic